Welcome. Have you ever experienced persistent, unexplained pain radiating down your arm or leg? It could be more than just a pulled muscle. Today we're exploring a rare but significant condition, autoimmune radiculopathy. We'll unravel its complexities, from causes and symptoms to diagnosis and treatment. Join us as we delve into the world of autoimmune radiculopathy, shedding light on this often misunderstood disease. The exact cause of autoimmune radiculopathy is still being investigated, but fundamentally, it's a case of mistaken identity. The body's immune system, designed to protect us from foreign invaders, mistakenly attacks the nerve roots, specifically the dorsal and ventral roots. These are the parts of the nerve that exit the spinal cord. This immune attack is thought to be triggered by a combination of genetic predisposition and environmental factors. Some theories suggest prior viral infections or other immune system imbalances may play a role, but more research is needed to fully understand the specific triggers. Let's break down the pathophysiology. In autoimmune radiculopathy, the immune system targets the myelin sheath or the axons of the nerve roots. The immune system mistakenly identifies proteins on these structures as foreign. This triggers an inflammatory response, leading to demyelination, the stripping away of the protective myelin sheath, or even direct damage to the axons themselves. The inflammation and damage disrupt the normal transmission of nerve signals. This disruption causes a range of neurological symptoms, including pain, weakness, and sensory disturbances in the areas served by the affected nerve roots. Autoimmune radiculopathy is considered a rare condition. Precise epidemiological data is limited due to its diagnostic challenges and potential for misdiagnosis. While it can affect people of any age, it is more commonly observed in adults. Studies are ongoing to determine the true prevalence and incidence of this disease, as well as to identify any specific populations that may be at higher risk. The signs and symptoms of autoimmune radiculopathy can vary depending on the specific nerve roots involved. The hallmark symptom is often radiating pain, typically described as burning, shooting, or electric-like. This pain commonly follows a dermatomal pattern, meaning it radiates along the path of a specific nerve. Other symptoms include weakness in the muscles supplied by the affected nerve root, sensory changes like numbness, tingling, or prickling sensations, and in some cases, loss of reflexes. Symptoms can develop gradually or rapidly, and may be intermittent or constant. It's important to note that these symptoms can mimic other conditions, making accurate diagnosis crucial. Diagnosing autoimmune radiculopathy can be challenging. The process typically involves a thorough neurological examination to assess muscle strength, reflexes, and sensory function. Imaging studies, such as MRI of the spine, are used to rule out other conditions like herniated discs or spinal cord compression. Nerve conduction studies and electromyography (EMG) can help identify nerve damage and dysfunction. A lumbar puncture or spinal tap may be performed to analyze the cerebrospinal fluid for signs of inflammation or abnormal immune activity. Finally, blood tests might be conducted to check for the presence of specific autoantibodies that are associated with autoimmune disorders. The diagnosis is often made by excluding other potential causes and piecing together the clinical presentation, imaging findings, and electrodiagnostic results. While not always distinctly classified into types, autoimmune radiculopathy can be considered based on the affected nerve roots. Cervical radiculopathy affects the nerve roots in the neck, causing pain and symptoms in the arms and hands. Thoracic radiculopathy involves the nerve roots in the mid-back, leading to pain in the chest or abdomen. Lumbar or sacral radiculopathy affects the nerve roots in the lower back, resulting in pain and symptoms in the legs and feet. The specific location of nerve root involvement dictates the specific symptoms experienced. The treatment of autoimmune radiculopathy is primarily focused on managing symptoms and suppressing the immune system. Corticosteroids, such as prednisone, are often used to reduce inflammation. Immunosuppressant drugs like methotrexate or azathioprine may be prescribed to dampen the immune response over the long term. Intravenous immunoglobulin (IVIG) therapy involves infusing antibodies from healthy donors to help modulate the immune system. Plasma exchange or plasmapheresis can be used to remove harmful antibodies from the blood. Physical therapy plays an important role in strengthening muscles, improving range of motion, and managing pain. Pain medications, including analgesics and nerve pain medications, can also be used to alleviate discomfort. The specific treatment plan is tailored to the individual patient and the severity of their symptoms. Currently, there is no known way to definitively prevent autoimmune radiculopathy. Given the potential role of infections in triggering autoimmune responses, maintaining good hygiene and receiving recommended vaccinations may be beneficial. However, the complex interplay of genetic and environmental factors makes prevention challenging. Further research is needed to identify specific risk factors and develop targeted prevention strategies. The prognosis of autoimmune radiculopathy varies depending on the individual and the severity of the disease. Some individuals experience significant improvement with treatment, while others may have persistent symptoms. Early diagnosis and treatment are associated with better outcomes. Research is ongoing to identify new therapeutic targets and improve treatment strategies. Recent advances in understanding the immune mechanisms underlying autoimmune radiculopathy are paving the way for more targeted and effective therapies in the future. Ongoing clinical trials are exploring the potential of novel immunomodulatory agents and regenerative medicine approaches to improve long-term outcomes for individuals with this challenging condition.